I wanted to jump right into the headlines and talk a little bit about Ebola. You surprised me a little bit. In some ways, you said there's some good news here about how people have responded. You want to say a little bit more about how you see the current crisis and the reactions from governments around the world?
Well, it's certainly tragic that we have this Ebola epidemic. It's killed thousands. It's also caused the health systems in these countries to shut down. You're having lots of excess deaths from other causes, even beyond Ebola. So the sooner we can stop the Ebola deaths and actually build decent primary healthcare systems in these three countries, the better. Of course, we also have to make sure it doesn't spread to a lot of other countries, including countries that have poor health systems that would have a hard time damping the disease down. I think it's amazing how the United States has responded to this. Tom Frieden, the head of CDC, went in personally, looked at it, really told people that we had to galvanize a gigantic response. He talked to the president, who chose to involve Department of Defense, whose logistical capability to go into tough places, get planes in and out, get material in and out, I think will be the thing that makes a big difference.
Is there a big idea that's not on the table yet that you think should be on the table in terms of dealing with the crisis?
The idea of how quickly we can take some of these drugs and get them to some of those patients. Do you have to do the sort of normal review of the manufacturing and trials and things like that? How much we suspend business as usual and put things in there, and who decides that if there's some slight increased risk of a side effect, you know, the benefits here outweigh that. It's very tricky because really the world is not very practiced at what resources should come in and how these decisions should be made.
Where did this interest come from, this level of intensity around helping people out of extreme poverty?
Well, if you live near to people who didn't have enough to eat and whose kids weren't developing physically and mentally, you know, dying of malaria, if they were your neighbors, you'd go get the bed nets and make sure the nutrition was there. Unfortunately, we're not seeing that. And so our human sympathy that would be aroused as soon as we're exposed to it is suppressed.
But let me push you on that. So lots of people have either seen it locally or they've seen it on television, etc., and don't always get pulled to it, or certainly don't end up dedicating their life to it. So literally, what ended up making you dedicate this amount of effort and this amount of resources to this effort, not for a year, but for a prolonged period of time?
I've been very lucky that the amount of resource I have to give back somewhere is very large. So the idea of, okay, how could I have the biggest impact? You know, I've seen science at work. I've been able to go out to the countries and see, you know, if you see a ward of kids with malaria, several of whom are going to die, if you see the limited medical stuff that's available there, it's kind of stark that, you know, most people in Africa are born and die without ever meeting what we'd think of as a full-blown doctor. I was kind of shocked that things like diarrhea weren't getting more attention. In a way, I said, wow, okay, that's what Melinda and I can partner together. By traveling, by reading a lot, we've seen that the greatest inequity is that these very basic health interventions aren't available to the poorest. And so a poor child in many countries like Nigeria, over 15% die before the age of 5, whereas in our country it's way below 1%. When you're talking about solving health problems of the very poorest, there isn't a market there. So malaria is not some big profit opportunity. And so we've spent less money on malaria than things like baldness, you know, way less. Why hasn't science gone after malaria and diarrhea, pneumonia, the modest number of things that would bring us health equity so that all children's lives are treated as though they have equal value? And so that's become the biggest part of our foundation. And we get to go out and see that there's still challenges, but there's a lot of progress being made.